Palpating for stifle effusion requires placing one's fingers on the medial aspect of the joint and palpating simultaneously to determine if there is any pouching or soft water balloon type feel to the joints. The presence of medial buttress is not effusion, but thickening of the joint capsule attachment to the tibia, and it should also be noted. When palpating the stifle joint, it's important to feel patellar position as part of the patellofemoral exam. By taking the weight slightly off the patient, isolating the patella, one is able to put medial pressure, lateral pressure to determine the presence of a subluxation or luxation. It can be helpful to mobilize the distal limb and use a combination of external and internal rotation with the different patellar motions. When checking the stifle further, range of motion is important. Dogs should have a full flexion where the tip of their hock is able to contact the back of their thigh and do that comfortably. With extension, isolating the knee and then placing the stifle into full extension and maintaining that position allows you to check for the presence of hyperextension discomfort, which is very important in partial cruciate injury. Once the limb is in this offloaded position, it's a good idea to check for medial instability, lateral instability, the degree of internal rotation and any discomfort during that exam, and also cranial thrust can be determined by placing my right hand around the stifle, my finger on top of the tibial crest, and the butt of my finger resting on the patella. I'm able to flex the stifle and look for any sign of cranial motion of the tibia. That can be done with the knee in external rotation, neutral, and internal rotation. The other aspect of this test is it should be performed with the knee in slight flexion, standing position, and more extension, as the results can vary with stifle position.